Today, in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon Se, Samvad Sarokar News, Organ Donation India Foundation and Gyan, our endeavor is to enlighten you about the current topics as well as impact of COVID-19. And today we have a very, very important topic, that is COVID-19 impact on organ donation. Without the organ donor, there is no story, no hope, no transplant. But when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. Awareness of organ donation for people to realize, that death is not the end of things. People can live on through others through this. Organ donation is the process of allowing organ or tissues to be removed surgically from one person to place it in another person. It is done by the consent of donor in case he is alive, or by the consent of next of kin after brain death. Kidneys, liver, lungs, heart, bones, bone marrow, skin, pancreas, corneas, intestines, and skins are commonly used for transplantation to render new life to the recipient. Organ donation is mostly done after the donor's death. However, certain organs and tissues such as a kidney, lobe of a lung, portion of the liver, intestine, or pancreas can be donated by living donors as well. The first living organ donor in a successful transplant was Ronald Lee Herrick. He was born in 1931 and died in 2010. He donated a kidney to his identical twin brother in 1954. The youngest organ donor was a baby in 2015 who lived for only 100 minutes and donated his kidney to an adult with renal failure. The oldest known organ donor was a 92 years old Texas man whose family chose to donate his liver after he died of a brain hemorrhage. Organ donations are legal by Indian law. The Indian government enacted the Transplantation of Human Organs Act, THOA, 1994, which allows organ donation and legalized the concept of brain death. Brain death is the irreversible and permanent cessation of all brain functions. In situations of brain death, a person cannot sustain his own life, but vital body functions may be maintained in an intensive care unit for a short period of time. Such persons are kept on artificial support to maintain oxygenation of organs so that the organs are in a healthy condition until they are removed. Organs of such patients can be transplanted to terminally ill patients. One brain death person can save up to 8 lives and improvise up to 75 lives. The National Organ and Tissue Transplant Organization, NATO, functions as the apex body for the activities of relating to procurement, allotment, and distribution of organs in the country. Although India has performed the second largest numbers of transplants in the world in 2019 after United States, it lags far behind the Western nations like Spain, 35.1 PMP, that is per million population, United States 21.9 PMP, and United Kingdom 15.5 PMP. In national donation, with a donation rate of only 0.65 per million population in 2019. According to World Health Organization, only around 0.01% of people in India donate their organs after death. Some of the reasons behind such poor performance are lack of public awareness, religious or superstitious beliefs among people, strict laws. In 2019, the Government of India implemented the National Organ Transplant Program with a budget of 149.5 crores for promoting diseased organ donation. In India, every year, about 5 lakhs people die because of non-available availability of organs. These many lives can be saved if we all decide to pledge to donate organs. In UK, last year approximately 700 persons died for want of organs, and approximately 7,500 persons died in USA for want of organs. To minimize the death in India, we have to create more and more awareness. During these troubled times of COVID pandemic, the world around us has come to a standstill. Organ donation as well as transplants have reduced drastically. Due to the COVID patients with the stage disease due to failure of kidney, liver, heart, and lungs are following the pandemic with increasing anxiety. While the kidney failure patients can continue dialysis, albeit at slightly higher risk of contracting COVID-19, there is no such luxury for patients with a failing liver, heart, or lung. The impact of delaying a transplant could be catastrophic. Today, to discuss this serious issue, we have very elite panel with us, the expert doctors who are doing transplants will be giving their views and will be telling us what are their views on COVID-19 impact on organ donation. My first guest is Professor Dr. Mujibur Rahman. Dr. Mujibur Rahman, MS, MRCS, DNB General Surgery, DNB Urology, FICR, is the professor and head of the Department of Urology, Renal Transplant and Robotics at Yenopaya Medical College, Mangalore. He is the founder chairman of Prostate Care Foundation, Mangalore. He has done MBBS from Government Medical College, Calicut, MS from Government Medical College, Trivandrum, DNB General Surgery from Madras Medical College, and DNB Urology from Calicut Medical College, Calicut. He has done clinical fellowships in endourology from European Board of Urology, Coburg, Germany, fellowship in robotic surgery, World Laparoscopic Hospital, Gurgaon, and Da Vinci robotic training from Seoul, South Korea. He was awarded Best Doctor Award in 2006 by Indian Medical Trust and Best Teacher Award in 2020 by Yenopaya University. He is a mentor and part of renal transplantation team of ICRA Hospital, Calicut since 2018. He has published 22 papers in reputed journals. He is involved in 7 research projects. Welcome, Dr. Mujibur Rahman, on our show. Dr. Rahman, you know very well what is the condition today about the organ donation, and especially during this pandemic, the COVID-19. We would like to know the COVID-19 impact on organ donation. Dr. Mujibur Rahman, please. Please unmute. Doctor, please unmute yourself. Dr. Mujib, please unmute.
Hello.
Yes, please.
Yeah, hello. Thank you, Mr. Goel, and good morning, everyone. Today, we are sitting here, we have expert panelists. I'll be discussing basically on what the surgical aspect of the COVID influence on transplant programs. The COVID, the urologists basically involved in donor harvesting in the deceased kidney, as well as live related donors, as well as the replantation into the recipient. The second part of the kidney transplant, that is the recipient treatment and modification of the immunosuppression role, will be discussed by expert nephrologist, Dr. Santosh Pai. I'll be just briefing about what is the criteria on transplantation deceased donors as well as the live related donors. And this, as you all know, like we are all aware that coronavirus, it is the old SARS virus, that severe acute respiratory syndrome virus, which was identified in December 19th. And that's why this COVID-19, that name has come, that 19 has come because it was in 2019. And must have seen that similar SARS virus infections have happened in Africa long way in 90s. And so many movies also has come based on this. So based, the Indian Ministry of Health and Family Welfare they have issued the norms and conditions and other precautionary measures to be taken during this COVID. And in that, nobody knows like how it has to be managed. And they also have given in most of the literature issued by the Family of Health and Family Welfare that nobody should be penalized for the treatment what you issue. Why? Because we are all learning together. And what in the lockdown and March when India we started, it's not the same thing what we are practicing initially, but except for a few points like social distancing as well as wearing the mask and how it has to be the PPEs and all. And lots of even initial the lockdown has come, the government has issued and they are doing a good job and giving time to time they are changing depending on the how the disease behavior is happening, the change in the trend of the disease as well. So coming back to this COVID SARS virus, like initially when we were doing this transplant program, we had a deceased donor, a live related donor and a recipient, and as well as the whoever is not able to undergo the transplant, the dialysis program to continue as far as the kidney is concerned. And in this COVID situation, what has happened is there is most of the hospitals have shunted or shifted their priority towards the treating the COVID patients and occupy this engaging the hospital staff as well as the infrastructure for the treatment of the COVID patients, and non-emergency surgery has been sidelined or it has been given priority second to the treatment of the COVID viruses. So what I would like to stress is in kidney transplant patient, we have a standby, like you can give a dialysis support, unlike in acute liver failure where you need an emergency treatment like emergency liver transplant. That I find is an emergency during this COVID period. Other surgeries, they have even including in the US, European countries as well as in India has taken a setback, except in a few centers who still control, so will continue with the transplant program. In our institute also, we have set aside the transplant program to some extent, except for the emergency surgeries as well as the
I think
even theaters are being given priority for the treatment of the COVID as the number of COVID patients are more. So as far as the donor is considered, this suppose there is a deceased donor, unlike previously what we were doing was, suppose there is a healthy brainstem dead patient in the ICU, we used to inform the patients, we used to take a history of the patient, like what is the reason for the death of the patient, what was the premorbid conditions, what were diabetes, hypertension, whether it's a RTA, whether the patient can be is a suitable candidate for a transplant once the brainstem occurs. Now, what we have to do, the epidemiological and the demographics of the patient, from where he comes, and we have to go for a detailed evaluation of the donor. In the sense, we have to see whether the patient had, in the history, we have to include whether the patient had a fever, whether the patient had any acute like upper respiratory tract infection, was there anything that is suggestive of a pneumonia as the cause of the death. So we have to exclude from the clinical scenario, you have to go in depth into the clinical before evaluate, because we don't know or we don't have the patient or the relative who can give a detailed history of the cause of death, especially during this COVID pandemic. So what we have to detail history, and a COVID test has to be done for the donor as well. Even the deceased nasopharyngeal swab has to be taken, and you have to confirm whether it's not because of the COVID. If it is because of the COVID, it's better not to use it, even though there is no conclusive evidence to say that the COVID gets transmitted through the blood transfusion or organ donation. But to be on the surface side, it is better not to do, and the nasopharyngeal swab has to be taken before considering this patient as a potential brainstem organ donor. The second, the live related donors. Again, the scenario is the same. We have to evaluate the donor criteria. You have to see like pre-COVID era. And this nasopharyngeal swab has to be taken 3 days prior to the proposed organ harvesting, because what you have to consider in this renal transplant, the donor is not a patient. It's a normal person, and who is giving a good kidney to another person. So in these cases also, asymptomatic COVID carriers, they can also transmit the COVID, not only to the patient, but also to the hospital staff and the other OT, ICU, all these staff has to be given priority, and this patient has to be taken 3 days prior to, within the 3 days of proposed transplant. And the third thing is the recipient. The other thing also I would like to touch upon before I hand over the mic to my colleagues. This there should be, suppose there is a transplant recipient, if he is there, he is again prone for COVID infection when he goes out. The best thing is in-house, stay home, stay safe. That mantra has to be strictly practiced. And this is the era where you, instead of the patient coming to your hospital, you can have a very good telemedicine, telecommunication system, and even the WhatsApp calls and the WhatsApp video calls you can have. And whoever is already a recipient, they can stay at home, communicate with the hospital or the transplant unit and the dialysis unit. If they get the fever, low grade fever, they can stay at home, get the medicine. And suppose there is a little more severe, or there is any respiratory illness or something, and CT, even though the respiratory, they might not show you the some signs and symptoms like a fever, back pain, cough, or myalgia, and those kind of clinical symptoms may not be there for the immunosuppressed as well as the transplant recipient patient. So these patients can stay at home, and what they can do is they can communicate with the transplant unit if there is any symptom, and there is a video call has to be can be made, and we can tell them, like, because during the lockdown period they can keep all the medicine at least for 2 months and all, they can keep at home, and they can be in constant communication with the transplant as well as the dialysis unit. And if there is a respiratory illness or respiratory problem for this, there's a high grade disease of the SARS, they can get admitted to the emergency unit of the neighboring instead of coming to the hospital. So that's what I would suggest in this. And any clarification if it's required regarding this deceased donor or the live related as well as the already transplanted recipients, if they require any clarification regarding this, I am here. And I would like to hand over the mic to my
Yeah.
colleagues.
Thank you, Dr. Mujib Rahman, for giving the details. And according to Dr. Rahman, initially when this lockdown started, the COVID started, and the government has announced the lockdown. The hospitals were locked down; either they were shut totally, or started giving the priority to the COVID patients, and that's why the elective surgeries, which were not non-emergency surgeries, were on hold. And this especially the organ donation or organ transplant surgeries were also on hold, because at that time the pattern of the coronavirus was not known, whether the coronavirus can be transferred from the donor to recipient or not. But what Dr. Mujibur Rahman says, that even now, whenever they are receiving any donor, they first want to see whether the donor, if he is alive, whether he is suffering from COVID or not. For that, they take the prior swab test, and once the test is negative, then only they
Yeah.
go for the
My practical
transplant.
experience. Yeah, I would like to share a few points like practical experience. I was going through the literature. Whatever is the literature is there is from China. Few institutional studies are there, and some observational studies during the transplant that has come, that they have performed in Europe one center as well as in China. What they have noticed is there is no increased morbidity or mortality associated if you do the screening properly. That's what. And my own personal experience with the center with whom I'm associated, from March till last Saturday, we have done nearly 12 transplants, all live related. All of them are well. What we have done, and what we have followed up also, the donor as well as the recipient, they didn't have any increased morbidity. And during this period, the donors, what we used to evaluate was, suppose we are doing it on a Saturday, we used to have a COVID repeat on again on the day prior to, that's on Friday, again, we are taking a nasopharyngeal swab of both the donor and the recipient. And we are telling the transplant coordinator to take a detailed epidemiology of the place where they are coming, at the household, whether there is any symptomatic patients, the near relatives or the bystander, and we are allowing only one bystander to the room. Nobody will be allowed into the hospital. So the transmission chance is very less. And once they come to the hospital premises, I don't advocate, like what in the US they practiced initially was the mask thing. Especially it has to be worn, and they have seen the studies, like in the hospital atmosphere where the chances of the COVID being transmitted is more, the mask is compulsory, and the distancing as far as possible, and the time spent in the hospital has to be minimized to the maximally you have to give care to the, and instruction has to be given to spend time minimal in the hospital premises. That's what, to conclude, there is the center where I am associated with, the 12 transplant, there is no donor morbidity, no recipient morbidity, the renal function is good, and the discharge time is, the complications are comparable to the non-COVID era, and the transplant results like the urine output and the renal function improvement post-transplant, the time to attain that and the discharge dates, there is no variation from the pre-COVID area if you do a good screening pre-operatively and you give a good intraoperative and perioperative care to the patient. Thank you.
Okay. Thank you, Dr. Mujib. And according to Dr. Mujib, the reports which are the research or reports are there only available from China. And the China report says that even those who has been transplanted during the COVID time, there is no such incident that any disease has been increased or morbidity has been increased. Whatsoever the pre-COVID era, same is in the during the COVID. And according to Dr. Mujib, they have done and at Unipaya Medical College about 12 transplants in the last from March till date, and they says that all the 12, the donors and the recipients are of the having the same pattern which was the pre-COVID era. So according to them, if the one rider is there that yes, the doctor has to see, the hospital has to screen the patient thoroughly, and the coordinators even has to check up their household, their surroundings, so that they should not there should not be any symptomatic patient nearby, so then it should not be transferred. So according to Dr. Mujib, if the screening is done properly, there is no problem for doing any organ transplants even now in the COVID era. Thank you, Dr. Mujib, for giving your views about
Thank you very much.
COVID-19 impact on organ donation. Now, I would like to invite my next guest. He's Dr. Joe Joseph. Dr. Joe Joseph is MD DM Cardiology. He is the consultant interventional cardiologist and transplant cardiologist, Lizzie Hospital, Kochi. Dr. Joseph has done MBBS from Government Medical College, Kottayam, MD from SCB Medical College, Cuttack, and DM from All India Institute of Medical Science, AIIMS, New Delhi. Dr. Joseph has done 25 cardiac transplantation and 1 heart-lung transplantation. Welcome, Dr. Joseph, on our show. You have heard what Dr. Mujib has said, and his emphasis was that if the screening was done properly, then there is no problem to do any transplantation, even in the COVID time. And he said that at their hospital, they have done 12 transplants during this period of last almost 6 months, and all the patients and the donors and the recipients all are doing fine, and there is nothing they have seen which is alarming, which was not there pre-COVID era. So according to Dr. Mujib, if the screening is done nicely by the hospital, by the doctors as well as the coordinators, then not to fear, and the transplant can take place. Now, we would like to know the COVID-19 impact on organ donation from Dr. Joe Joseph, please. No, doctor, your voice is not coming.
Hello, sir. Am I audible right now?
Yeah, yes, now you are audible.
Yes. Thank you for the nice words. I really enjoyed Dr. Mujib's presentation because we want to hear some information regarding the kidney transplantation as well as the transplantation from across the country. And I'll be discussing a few points regarding the impact of COVID on organ transplantation, especially from the heart transplantation point of view. I would like to say from the start by saying that the pandemic has affected everybody. Now, nobody in the world has been spared of the impact of COVID in some way or the other. And the most important thing is that the healthcare professionals, the healthcare system has been affected the most. And obviously, the effect has fallen on the transplant also. So looking at the literature, from the first thing was the virus started from Wuhan, and the ground reports from Wuhan will clearly says that all the transplant activities were stopped in Wuhan during the initial part of the pandemic. Subsequently, the transplantation once the pandemic is under control, the transplantation activity has behind in Wuhan also. We got an excellent Lancet paper which clearly mentions about the impact of COVID on transplantations. We got data from France, and the data from the France in the early part, that is in April and May, shows that the transplantations in France has reduced to the tune of around 91%. We got a data in the same paper which has published says that the transplantations in the US has decreased around 51%. This is the overall transplantation. Overall transplantation is not isolated to any particular organ, but the main driver is the kidney transplantation, because that's the most common transplantation which is happening. And as you know, around 1.5 lakh transplantation used to take place in the world, and 15 lakh people are right now living with a transplanted organ. So we got another Lancet paper from the UK, which clearly shows that the donations as well as the transplantations has decreased to the tune of around 66%. So that percentage was really much more than the expected by the UK authorities. So the same thing is happening in India also. So we are also seeing a lot of transplantations. The donations have come down drastically, and we'll be looking into the impact of COVID on organ donations. We'll be looking into the challenges faced by the COVID on the transplantation as well as its procurement, and I'll be touching up a little about the heart transplantation. So what is the challenges faced by us is, especially from the cardiac transplant point of view, is that if you do a surgery for any other diseases, it involves the surgeon, you, and the hospital. But transplant is not a simple thing. It is a multidisciplinary thing. You have to have the involvement of so many people. They have to have the involvement of the transplant team, the recipient team, the donor maybe in another hospital, that has to be coordinated. Then there will be the state authorities will be there for coordinating the activities, and then the transplant coordinators, the policemen for the green corridor and all those things. Then at least in our hospital, if an alert comes for a transplant, at least around 100 systems starts moving. So that is the large amount of teamwork which has to be played during a transplant. So all these processes are affected by transplant. So the main priority of the health system now is to fight the pandemic, and as a result, the activity transplant, the priority for transplant has come down drastically, even for the state organizations. So we got what is called as the KNOS, which is coordinating all the transplant activities in the state. That's a government body, and most of the government bodies are very actively fighting the pandemic now. Second is the challenges associated with the disease itself. The disease poses new challenges because we don't know what is the disease is only very, very new. It's almost maybe 9 months old disease. So we don't know a large part of the disease, but we are still learning. We learned a lot about the disease. There are a lot of ifs and buts associated with the disease, about the treatment, about the diagnosis, about the mode of transmission. Yeah, today also we know that the WHO was saying that aerosols can transmit the disease, but we don't know. Right now they are saying that aerosols may not be the cause. The same thing is regarding the blood related transmission. There was some reports that the blood may be responsible for transmission, but we don't have a very solid data for that, because that is the most important thing in organ transplantation. So then the treatments, we don't have a treatment which is available for this disease. So that the disease itself has got a lot of ifs and buts associated with it. And third is the definite lack of donations. That's the most important thing that is coming from across the country, not only from other parts of the world, but also from India also. As you know, heart transplantation depends upon the deceased donor program. As it depends upon the epidemiological trend of the disease. If right now we are in a very, especially the part or southern part of India, and some other states are experiencing a explosive number of cases. So the epidemiological pattern is not a very suitable system ground for or donations right now. That is seen across the country, even from Karnataka, even from Tamil Nadu, because Tamil Nadu used to have a very good donation program. The donations are significantly decreased as per the reports available from the Mohan Foundation. Also, Telangana, there is a lot of the transplantation donation activities has come down. So that is the systems associated right now. But on the other hand, some of the donations in some of the states have increased. For example, in Kerala, we are seeing a increase in the donations during the transplant time. I'll say about the heart transplantations. We got at least around 5 transplants done in Kerala during the during the COVID time. 2 in our hospital, 3 in other centers. So why there is an increase in that donation rate? Because I will say that the most important cause for donation, one of the most important causes, as one of the important cause of lack of donation, is the trust between the healthcare system as well as the doctors, healthcare system, doctors, as well as the patients. And because of the obviously because of the pandemic, a large amount, this loss of faith has been regained. Some of this lost faith has been regained because of the activities of the healthcare professionals during the COVID time. So there is the people have some more faith in the healthcare system, and that has contributed to the increase. Maybe one of the reasons we have contributed to the increase in the donations from Kerala. And there are reports of heart transplantation being done in Mumbai, reports of heart transplantation being very common done in Chennai, even though the numbers are less compared to the pre-transplant area. So so there are transplants are happening in India, but it is very less. And coming to the aspect of heart transplantation, we will look at into the global data. The global data, there are very good papers from the US. One from the Mount Sinai Hospital, where they have looked into the outcome of heart transplant patients on because of the COVID. They looked into around 22 COVID transplanted patients developing COVID, and they find that these patients are at increased risk for mortality. And but they claim that in the paper they claim that mortality is almost the same in tune with the patients who are in the critically ill patients. Their mortality was something to the tune of around in the 22 patients, around 23% of patients died. So, and it poses a lot of challenges for the transplanted patients, because it affects the two things, because most of these patients are immunocompromised patients. Some of the patients may be having diabetic. Immunocompromised patients is at risk for developing COVID infections. And although there is reports in the contrary that some immunosuppressions may decrease the viral replications, but we don't have a good scientific evidence for that. So the immunosuppression is a risk factor for COVID infection. We have to modify the immunosuppressions during this time, and these patients may develop subsequent infections. This leads to increase the mortality of these patients. And there is also another paper from the US, which also clearly says that these patients are at increased risk of mortality. And also the US claims that the waiting list on transplant is increased, and the dropout from the waiting list, because the dropout from the waiting list occurs after transplantation, that has reduced, means that the transplantation has decreased. So and also some of the drugs which are used for the treatment of patients with heart transplantation, that is immunosuppressions, dose has to be modified when the patient is taking some medications for antiviral therapy, as well as azithromycin, hydroxychloroquine, because these patients may be a lot of medication. The medications dose has to be changed. That also plays an important challenge for us. And I think these are the things which I want to make. And the most important thing is it's not an absolute no to transplantation. We should individualize the decisions based on the patients, because it's very difficult to get a heart during these times, and a wastage of the heart means because we are losing patients on a transplant list. So that should not happen. So the decision is that we should not do a transplant during transplantation, but it has to be individualized. It has to be individualized depending upon the condition of the patient, depending upon the logistics available in the particular hospital, depending upon the epidemiological trend of a particular region, particular hospital during this pandemic. And right now, as far as our hospital is concerned, maybe we may be reluctant to do a transplant right now, because we are seeing a large amount of cases in our part of the country right now. And so and most of these patients may have to live in the hospital for at least around maybe 3 to 4 weeks, and increasing the duration of hospitalization itself is a risk factor for acquiring this COVID-19. So right now I may not be doing a transplant, but once the epidemiological trend decreases, the number of cases decreases, definitely we will do a transplant. And regarding the future of heart and lung transplantation after the COVID, because COVID poses new challenges as well as new opportunities also, because there are reports of large amount of reports coming about the chronic problems associated with the COVID, and COVID primarily affected the lungs. A lot of reports are coming from, especially from China as well as the US, regarding the chronic long-standing fibrosis of the lungs. So even lung transplantation, bilateral lung as well as single lung transplantations has been done in patients who are suffering from the chronic sequelae of this disease also. That initially it started in China. Right now, lung transplants are being done in the West. In India also, we got at least around 2 or 3 centers, two or three patients who underwent lung transplant. And as per the information I got from a very well-known transplant surgeon, lung transplants there will be an increased number of lung transplants in India, maybe 2 or 3 years down the line, because of the COVID-related lung problems. So it's a challenging time for us. But we are seeing some rays of hope and silver lines during the dark clouds, because transplants are picking. A lot of centers are doing transplants. And third thing is that our systems are gaining knowledge day by day. Systems are improving day by day. So transplants will happen depending upon the epidemiological pattern. And also we will have a new there will be new openings or for transplants, especially because of the chronic sequelae of this disease also. Thank you so much.
Thank you, Dr. Joseph. And as per Dr. Joseph, the disease which started from Wuhan, the initial report says that the transplants are very risky. But afterwards, they found that once it was controlled, they started the transplants in China, and the transplants were going on. And then they found that there is no change in the whether it's a pre-COVID or during the COVID or post-COVID transplants. But in India, especially for the heart transplant, according to Dr. Joseph, it is not advisable because of the so many factors, because he says it is not one agency or two or three agencies. One transplant means at least 100 agencies are working at one time. And because of the COVID, right now the priority of the government and all the medical fraternity is for the COVID related patients. So until unless there is an emergency, although he also mentioned that if there is a donor, and if the heart, because heart is taken only when there is a brain death, it's not a living donor. So if there is a brain death, they do not want to waste that heart, because after all, it's a life, it's a matter of saving a life. And he has quoted, he has given the data from the Lancet. He says that in USA, UK, and other France, the organ donation, organ transplants had reduced. In France, it is about 91%, and in USA, it's at about 51%, and UK is about 61% or so. So now, when this is the trend, and in India also, he said, although they have done in their place at about 5 transplants in their own hospital, they have done 2 and 3 at other centers of the heart transplant during this period, and the patients are okay. There is nothing they found that pre-COVID or post-COVID, but still this problem is there, and it's in a very, very big way. And everyone is right now, because there is no data, solid data are available. No such research has taken place, although it's because it's only 9-month-old virus. But he has also mentioned that the lung transplants are will be the future, because the pandemic is affecting mainly on lungs, and already the lungs transplants are taking place in other countries. He has mentioned that even for the COVID treatment, some hospitals have started the lung transplants. Even in India, about 2 to 3 patients who were affected by COVID lungs were transplanted in them, and they are all okay. So all these data says that the transplant, according to him, there is an opportunity, although the pandemic is very bad, but because this opportunity, that post-COVID, there will be that surge definitely in the organ transplants, because because the COVID is going to affect the organs, and especially the lungs and other organs also. Thank you very much, Dr. Joseph, for giving your views, especially from the cardiac side. I'm sure the viewers who wants to know this difficult time, what they have to do, they are getting good expert opinions from both the doctors who have already spoken, Dr. Mujib and Dr. Joseph. Now I'm inviting my next guest. My next guest is Professor Dr. Santosh Pai, BH. Dr. Pai is MBBS, DNB General Medicine, DNB Nephrology. Professor Dr. Pai is the professor and head of the Department of Nephrology, Yenupaya Medical College, Mangalore. Professor Pai has done MBBS from Vijayanagar Institute of Medical Science, Bellary, DNB in General Medicine from Amrita Institute of Medical Science, Kochi, and DNB Nephrology from Nizam Institute of Medical Science, Hyderabad. Dr. Pai's papers were published in reputed journals. He was a speaker in national conferences. He is associate editor for Archives of Medical and Health Science Journal. Welcome, Dr. Pai, on our show. Dr. Pai, you have heard what Dr. Mujib and Dr. Joseph has said. Dr. Mujib was of view that that screening is very much required. Without screening, right now to do organ transplant is not advisable. And he said that although you are also in the same hospital, that their hospital, your hospital, Yenupaya Hospital, has done about 12 transplants during this period, and all were safe. All our patients, all the donors and the recipients, all are okay, because the screening was done very, very thoroughly. And he said that earlier there was lots of reservation whether we should do or not, but now when we are doing the proper screening, so there is no fear for the organ transplant. But Dr. Joseph said there are all contradictory reports are coming according to Dr. Joseph. Some says the organ donations have reduced and it is risky, especially for the heart. Some says now it is safe, one can very well do. And he has given the data of Lancet paper, and he has also mentioned that they have also done 2 at their center and 3 at other centers, the heart transplant. And he says the difficult time, because right now the organ donations is not taking place, and especially at this time when the COVID era is there, and all the government agencies, medical fraternity is busy with the COVID-19. It is very, very difficult to prolong or to do the transplantation at this juncture, and especially for the heart. But he is seeing the opportunity for the future. He says that the condition which is happening now definitely will increase the organ donation further, because the people will realize that if they have to save the lives of their near and dear post COVID, then they would have to do donation, and which will definitely save the lives. Now we would like to know the COVID-19 impact on organ donation from Professor Dr. Santosh Pai, please.
Yeah. Uh, good morning, sir. At the onset, I would like to thank you, Mr. Goel, sir, for giving me an opportunity, and you are doing a very wonderful job. By from years together, I'm seeing you in this organ donation rally, that you are a prominent figure in promoting organ donation. So I would start by saying that once COVID struck India, we went to a very stringent lockdown. During that phase, we were the whole attention shifted towards COVID rather than any other disease, and all diseases took a backseat. That in sense, all the treatment for the other diseases took a backseat. Now the hospitals were divided as COVID hospitals and non-COVID hospitals. And once the lockdown opened, probably because of the workload in COVID, the number of three in COVID pandemic, so all the hospitals were open for COVID patients. Now, coming to transplant, probably I would classify transplants into emergency transplants and relatively non-emergency transplants. Kidney diseases have a liberty that we consider kidney end-stage renal disease as a non-emergency transplant, because we have dialysis which continues the life of the patient. But while coming to heart, lungs, and liver, probably we don't have such a what you say benefit, means system where we can sustain these patients without transplant. So it becomes an emergency. Especially acute fulminant hepatic liver failure, you don't have time for waiting for the pandemic to end. And this pandemic is going to stay. It is not going to go. And we have changed our Prime Minister, and our government has started saying we should live with the pandemic, not away from the pandemic. So once when we say we should live with the pandemic, probably transplant has to stay and transplant has to go on. Now, what are the methods where we can mitigate the effect of COVID-19? Having said so, probably I would say that we usually classify centers into low volume centers and high volume centers. Now, the recommendations have been given by Ministry of Health and Family Welfare, and it has come in the Indian Society of Organ Transplant Journal also. What few methods we can take? See, it's not that the patient himself might be COVID positive or negative. It can be doctors, healthcare workers, nurses, ambulance drivers, pharmacists. All of these people work in the hospital, and anyone who comes in close contact of the patient can be a carrier of COVID, or he might be harboring COVID. So a dedicated isolation facility should be there in the hospital for the transplant work. Preferably, there should be two teams, because if, for example, if one team member gets COVID, probably they can go for quarantine and the other team take over. So that is a preferable thing. Among the nurses also, dedicated. See, the nurses should not be rotated to a COVID and non-COVID area. Preferably, I would like to say that there should be COVID, non-COVID hospitals where the transplants can be going on more. In fact, what I would like to say is those who are dedicated COVID hospitals, probably the transplant thing might be stopped and can be shifted to the non-COVID hospitals. This would give a breather for the patients also and for the doctors also. COVID, as such said, it's a stress for even the healthcare workers, not only patients, even for the healthcare workers. Because if the patient becomes COVID positive, and despite wearing PPE also, there is a surgical risk, or where the healthcare workers, including doctors, can get it. And we are seeing that so many doctors are dying because of COVID. So it becomes relatively difficult for us to go ahead with the transplant. Having said so, when it comes to nephrology, I don't see any reason for what we have to stop transplants, because COVID is going to stay and we should live with COVID. Now, coming to live related transplant, you take a proper consent with the patient. See, we all are human beings. We don't know when we can be struck with COVID. God forbid, if post transplant you get COVID, we'll try our level. It's not that once the patient gets COVID, he is going to die. 99% of the time they don't die. Only 1 to 2% people die. So, but complications can arise. The hospital stay can increase. The cost can go up. There might not be recovery also. So all these points can be put to the patient, and patient attendants can work like a team and go ahead with the transplant. This acts to be a very perfect milieu for the successful transplant program. Coming to cadaver, like how Dr. Mujib said, stringent screening methods, like with RT-PCR, nasal swabbing and throat swabbing, and even antibodies. See, already the government has started antibody testing. That means all those who have got COVID, or those who have not got COVID, but they have got COVID, but they don't know that they had COVID, because majority of them are asymptomatic. You do antibody testing, and if your antibody comes positive, probably these are the perfect people to work in the hospital also. And even those patients can be easily transplanted. So this type of things can be looked on. And coming to the COVID thing, probably it's time for us to shift to non-COVID diseases also. See, COVID diseases are there. There are good home quarantine guidelines. There are for sick patients, we can put them in ICUs, and all these things are okay. But I feel probably we are overstressing on the COVID issue. More than the disease itself, the media is fearing, the public is fearing that, and the quarantine, draconian quarantine rules, if you see, everyone fears that more than the disease. Initially, when COVID came, there was the same quarantine rules used to apply to the healthcare workers. So even if you are exposed to a COVID patient, we used to get quarantined. But now the government has relaxed that rules, and it's not that. So if you keep quarantining all doctors, probably there will be no one to work in the hospitals. So now they have relaxed, and it's not that you come in contact with COVID, you are quarantined. Even the quarantine days are also reduced. So similarly, the testing facility also should improve. See, we are in the hospitals, probably the dialysis staff, the patients have to be regularly swabbed and seen whether they have any thing. We are doing it in NFO. Actually, we are screening with antibody testing, whether those patients who are asymptomatic, whether they have already got COVID and recovered, and they are placed in COVID areas and transplant areas. And probably we should have inter-hospital mutual agreements also. See, for example, think we are doing transplants here and we get, God forbid, one of our staff or gets COVID, probably we can take help from the other hospital. The nephrologist or the urologist can come and see at that time. So similar way, there should be a mutual agreement. There should be backup staff for work, and the cost of PPEs and all has to be explained. See, the major bills are of PPE because everyone are afraid of COVID. You try to wear more precautions. So this thing has to be explained. The cost of transplant goes up. Coming to immunosuppression, there are no evidence to suggest that you should reduce immunosuppression or you have to increase immunosuppression. Probably all treatment protocols remains the same in what was there in pre-COVID time. We are following the same. There is no change in treatment protocols. So in just what I would like to say is COVID is going to stay. We have to live with COVID, proper screening, not only patients, even staff to have a proper backup. We should have more non-COVID hospitals where you can go for transplants, and all other diseases have taken backseat. Probably it's time that we focus on other diseases too, and no need to fear COVID. Go ahead with COVID, live with COVID. Yeah.
No fear to have, but COVID, you have to live with COVID, says Dr. Pai. Thank you, Dr. Pai, for giving your views. And according to Dr. Pai, initially it was a very stringent lockdown government has put, and everything was standstill. And because of that, all the transplants work were on the standstill. But gradually, when it was opened, they found that there is nothing to worry except what Dr. Mujib has also said, that if you will do the proper screening, then you have to start. But what Dr. Santosh Pai said, he said for the screening is one part, but the other part, the hospital should have at least 2 teams for the organ transplants. So if anyone comes under for the detected as a COVID positive, as a nurse or a ward boy or a doctor or a OT assistant, then the next team will immediately come, and the other team will go for quarantine, so that they can replace whenever they are done with their quarantine. But he says, and he also suggested one very interesting point is that the hospitals of the in the same city should have a mutual understanding, where if suppose one hospital is having some problem, a nephrologist or a urologist or any other doctor, they become a COVID positive, immediately the other team should come and do the work. He says, because this is after all, we have to save the lives, and this is only possible if we will all be devoted for this. And according to him, because the doctors are also dying, they are getting infection, we have to live with it. And now, according to Dr. Pai, our Prime Minister has also mentioned that we have to live with the corona. So when we have to live the corona, Dr. Pai says, then why we should stop our other activities? He said, yes, we are taking care of COVID, but it has been hyped more by the media or other agencies, which they should also consider about the non-COVID problems, non-COVID disease. And according to him, now this is the time that we should all start our own transplants things. We should not fear, but with full precautions we must take. And about the immunodepressive things, he says there is no findings whether it is a immunodepression drugs to be given or not to be given, whether they have to increase or not to to decrease their dose, which there is no solid finding or very finding which we can say we have to depend or not to depend on them. So according to Dr. Pai, we have to live with the corona, and when we have to live with the corona, we should start working normally. He also suggested that the government should have COVID hospitals separately and non-COVID hospitals separately, where the transplant takes place, and there we should do. And he said that at their hospital, that is Yenupaya Medical College, they have the antibody test of all the medical staff, so they know that whosoever has been developed the antibody, they were put in placed in the COVID area or the transplant area, so that they are sure that the doctor or the health worker will not get the infection, and they will not give the infection to the others. Thank you, Dr. Pai, for giving your views. Now I would like to ask Dr. Mujib. Dr. Mujib, today, when due to COVID, the government of India and all the state governments have woken up. Although you know very well that whatsoever death has occurred, the mortality rate is nothing of COVID, what we have seen for the want of organs. Today, as per the government data, I'm not giving my data, the more than 5 lakhs people were dying every year. That comes to more than 1,500 persons dying every day
Yeah.
for want of organs. Today, as per the data released by the government of India, about 1,000 people are dying by COVID. And the entire country is talking about COVID. Nobody bothers about the organ donation, organ transplants. And that too, these data are not complete. Many states government has not given their data of organ transplants. And so it means when so many people were dying, COVID, yes, we can save ourselves by taking some precautions. But organ transplants or death due to the organs can be saved. It is in our hand if we all decide to donate organs. Now, I would like to ask you, today when due to COVID, government and public attention is now on medical fraternity, do you think it will be advantageous for organ donation program in India?
Yeah, basically what happens is the government of India as well as the state government, they're doing a good job because we are all learning together, but it's not an easy disease. Nobody knows how the disease behaves. It's not only the kidney, as far as the kidney is concerned, we have a standby support, like the patient can be kept on dialysis. And the whole healthcare system has to be, the attention has to be diverted into treating the COVID, because in patients, especially like immunosuppressed patients and the elderly patients, and this patients with borderline lung or other kidneys and other moribund disease. These patients are susceptible to like high grade infection with the COVID. So what the government or given the instruction to the hospital authorities is to divert or to give more preference to the COVID patient, because it's like if the pandemic, once it affects, the oxygen supply as well as the ventilator support, it may not be sufficient to support the community. So that's why, in the renal failure patients, we can temporarily keep them on dialysis. And once the pandemic, this threat is over, we can get it. And taking these patients, as you asked, they're taking these samples for cadaver as well as brain dead patients, that evaluating them and taking them as well as the hospital infrastructure to give, as well as the post-operative and peri-operative care to give the transplant patients, the cost will be immense. Like Dr. Santosh Pai, he mentioned the PPE as well as ancillary supporting staff in the ICU and other hospital. It is immense. Because once one staff is becomes positive, we have to send them to the quarantine, and the other whoever get exposed to that sister or the staff, they also has to be kept under observation. So that's why the Family of Health and Ministry of Family Welfare, they have given strict order to the state government as well as the health providers to concentrate more during this period. Probably this will be over within a 2 months period. So we don't have to worry about the cadaveric transplant right now. What I think is evaluation and of these patients is costly at this moment. So whatever is immediate, like liver failure, acute liver failure, those kind of patients we can take up now. Other patients we can put him on dialysis and other supportive measures. Thank you.
Thank you, Dr. Mujib. But again, I will say one thing. I would like to add what you have said, that when government and the entire country, and rather I will say entire world, is talking about medical facilities, medical health, why not they should talk about organ donation when so many people are dying, and especially in India. I'm talking of India. If you see the figures of UK, USA, any other countries, why in India so many people are dying? Because because of the lack of awareness, because the lack of interest by the any government, whether it's a central government or state government. Anyway, that we will discuss afterwards. Now I would like to go to Dr. Joseph. Dr. Joseph, you have mentioned about the lung transplant. Now there are reports which says that in US, even UK, and even in India, those who have suffered by the COVID, the lung transplant can be a cure. Now they have transplanted. Now, do you think, because the reports which are coming, although it's a premature report, but the reports which are coming is that the COVID will definitely affect the organs and mainly the lungs. So once even the patient survives, whosoever surviving from the COVID, and if they are going to have the symptoms tomorrow and they will develop for the lungs, do you think that COVID can be cured, even cure, not even after post-COVID? Those who are suffering from the COVID can be cured by lung transplantation immediately if they will be given the lungs from by their relatives or anyone who wants to donate the lobe of the lungs to them, and it can be cured. Although Dr. Mujib has mentioned and Dr. Pai has mentioned about the cost, which I will take up with them separately. But I want to know whether the cure is possible of COVID-19 by transplanting the lungs. Please unmute.
No, it is not about the cure because it is not. It is the COVID is affecting mainly the lungs, but does not mean that by transplanting the lungs you can cure COVID. It's not like that. It is not at all a treatment option for COVID per se. But the problem with this COVID is that it is affecting the lungs primarily, and as a result, there will be long-standing problems, long-standing lung fibrosis. So the functional capacity of the lung will be reduced. In that situation, some of these patients may be on long-term ventilatory supports. A lot of patients, the patients who are underwent transplant were a lot on chronic ventilatory support. They were not able to wean off the ventilator because of the poor lung capacity. In this situation, they have transplanted the lung. And they are transplanted the lung once the patient becomes COVID negative, because by the time the COVID will be the disease process, the disease will improve. The patient will become COVID negative within 10 or 15 days after getting the infection. But the problem in the lung will persist, and these type of patients may not be able to wean off from the ventilator. In that situation, lung transplant has been done once the patient is negative. We got reports from China, we got reports from Italy, some reports from India also. And regarding how the transplantation is done, there was a question being asked whether we should do a transplant both the lungs or a single lung, but because a single lung, because one lung is enough for routine activities. But the centers which are done is clearly states that it is better to do a bilateral lung, to transplant both the lungs, because we don't know about the chronic activity persisting in the other lung will contribute to the disease activity in the transplanted lung. So as of now, the available knowledge and the literature, they're saying that if you're planning to do a transplant, it is better that you do a bilateral lung transplant.
Okay, thank you, Dr. Joseph. Because in my earlier program, the impact on cancer patients, I asked this question to Dr. Suresh H. Advani, renowned cancer specialist from Mumbai. I asked this question whether the post-COVID, the lung cancers will increase because of the, like you have mentioned about the fibrosis, etc. He said that there are no such studies till now which are showing the indication, but he clearly mentioned that definitely the COVID is going to affect the organs, which can be any organ, whether it is kidney or heart or lung or whatsoever organs, which we will see once the time will pass and more and more research will be done. Thank you, Dr. Joseph, for giving your views. Now, Dr. Pai, you have raised, Dr. Mujib has raised about the cost. Now, my question to you is, because I know one of my known means he has approached me for the lung transplant, and I have referred to the Mohan Foundation at Hyderabad, the CEO, and they got it done there, and they said that about 1 crore rupees they have to spend. How much they have spent, I can't say, because that figure they have given to me. But definitely, whether it is lung or liver or heart, the cost is very, very high. Even for those persons nowadays, because of the COVID, there is no income. Even the many times, even your kidney transplant for them is very expensive. There is no insurance. I was told that there are few insurance companies are started covering the organ transplant, but their premium is so high the common person cannot afford. We have an example of NHS in UK. Why not the medical fraternity like you, all doctors, write to the government, raise this question, ki when we are talking about COVID, when we are saying that everything is standstill, today the economy is based on medical health. See, health is more important than the wealth, and the wealth is nothing in front. Why not the government come out with a long term policy for providing a proper insurance, so that all the transplants can take place? Today the transplant is not taking place because the recipient knows that he has to shell out lots of money, which is not affordable. And only this lung, whether we are talking of lung transplants or the heart transplants or even liver transplants, is only can be afforded by not only rich, I will say super rich people. Kidneys, yes. Kidneys can be termed as a middle class disease, not even a, poor persons. So, what is your view about this? Because the cost is, as you said, the COVID time, PPE. Everyone has to change the PPE. Then you have limitations of the staff. Anyone become COVID positive, you require second staff. You have to shell out more money. The hospital, you means the hospital has to shell out more money. So many precautions. What you say, why not this is the right time, the government should change the policy and spend more money, so that the hospitals, the doctors and the patients all will be benefited. Dr. Pai, please.
As you mentioned, sir, a very valid point. See, coming to our country, the health has always had taken a backseat. The amount of GDP spent on health is negligible when compared to any other countries. Even worse countries than us in economic status spend more on health than our country. I really don't understand. See, there is nothing called as free in this world. Everything has comes with the cost. Now, for example, electricity, your travel through train or through bus, all government sectors, they charge you. Even if you go in AC compartment, it's very exorbitantly priced. Now, when it comes for health, I think government should be very serious to provide health to everyone at a affordable cost, or probably free. In sense, I say that you should be insured, like how we said that in NHS, every person should be insured. And just imagine if our 132 crore people are insured, with the premium will come down to almost nothing, and you can get a highest quality of health in our country. We probably have little difficulty in healthcare workers, in sense the number of healthcare workers, but it is increasing day by day. But the amount of work we have in our country, let it be transplants or is enormous. So once we increase the numbers, probably the cost will come down. For example, if you see renal transplant itself, some 20 years back, it was like liver or heart, very exorbitantly priced. But as the numbers increased, you know how you can cut short the cost. You can know how paying the staff will come down because the numbers increase. So similarly, heart and lung and liver also, the costs will come down. But someone should be interested. So I see the government is more focused So that is the pathetic thing what we have now. That is one. Second, the amount government is spending on health sector is almost negligible. Almost negligible. We are spending on non-essential things so much that I don't want to put it in the media now. but you always means everyone knows, which is not required. We spend so much of money, but where it really comes, we are not spending. Slowly, the government is doing its bit in sense they have started insurance schemes for everyone, but I think it has to do more. Cost is not at all a problem in India. Only thing is it's a relative thing. In sense, we are not ready to spend on health. As simple as that. Once that concept goes, I think cost will never be a factor.
Okay, thank you, Dr. Pai. And according to Dr. Pai, it's not the cost. We are ready to spend money,
And
but
one more.
the yes, please. You want to add something?
Yeah, one more thing is that now the government is given through the insurance scheme, the transplant is possible now for the poor socially backward communities. Now government is giving nearly 2.75 to 3 lakhs. They are giving for the renal transplant. That is a good move from the government side.
Okay, very good news. I think that is a very positive
And
news.
it is included in the SASTA as well. And most of the states in India now they are able to provide through the government schemes for the socially backward community people to undergo the transplant. The government is doing it at its best. And only
Okay,
thing is that awareness, as you
For
mentioned, it
liver,
has to be disseminated across the state. The transplant coordinators as well as the organization like yours should take the forward step in giving the awareness as well as the cadaveric transplant. Still, the barrier is the convincing the patient party when the brainstem death and the utilization of the 8 organs, as you mentioned. No? That has to be disseminated into that. It should percolate down into the grassroots level so that the families and the members in the families should come forward and when the brain death occurs. That is what the main barrier what we found in our practice in convincing the patient party when
see
the
what
brainstem death
Uh,
occurs.
yeah, Dr. Mujib, what you said about the brain death. See, the problem in India is we have a voluntary donation scheme. In USA, it is a opt-in scheme, and in Europe and UK, now from in UK from 20th of May, it is an opt-out scheme. Unless the government will come out with some regulations, either opt-out or opt-in, we cannot go for voluntary because as you know very well, the other day, I will give you an example. Even in Mangalore, one of the hostel, I got a call from the relative that we are interested for donation, and their parents were ready for donation. Their 14 years old boy was had a head injury, and he was declared brain death. But meanwhile, I spoke to the government coordinators, the coordinator of the hospital. They were ready to do it. One of the relative came and he put the sparrow. He said, no, don't do it. And they backtrack. Now, unless government will make it opt-out system, ki once you become adult, 18 years old, you have to decide you want to donate your organs or not. If you don't want to donate, fill up the form, say I do not want to. That is opt-out system. If otherwise all the organs deemed to be of the state and the government, at that time, definitely nobody will die. 5 lakhs or 8 lakhs people dying. See, that is what I always say. When we are talking of COVID, 1,000 people dying, every media, everywhere, every day, all WhatsApp messages are full of COVID. Why we are not talking more than 2,000, 1,500 to 2,000 people is still dying. And I'm sure now the figure has gone up because there is no organs available, as you all already mentioned. So, or we must follow the what is USA system, where once a person has filled up the form, and if he has not revoked that thing during his lifetime, then the family member will have no say. But here, the only problem is, even if the parents want, suppose today I have decided to donate my organs, and I've already done it. And tomorrow, after my brain death, they says, no, you cannot. Why? When my will, if I am putting my will and I say my property will go to so and so, for that, the rules are there, laws are there. When I am donating my organs today with full faith in myself, tomorrow, how come my family will have say? The other day we had a discussion on this also with some legal fraternity, and they said no, it is not possible because it should be in will. Will is not possible because the organs shelf life is very less. Anyway, thank you very much, Dr. Mujib. Now the last round, I want a very brief your suggestion to the government and advice to public. Dr. Mujib, please. Please unmute. Please unmute. Dr. Mujib, please unmute. Dr. Mujib, please unmute. Yeah.
These institutions, especially we'll talk in the scenario of the Mangalore, where we have 7 medical colleges. We should have meetings of the coordinators. And this government as such, what I feel is they are doing their stuff. I had one-to-one contact with this. Once the brain death happens, we used to call them. They are very proactive and they do their work very fast, and their team also is excellent team. What I would rate them as one of the best I have seen in Karnataka. So only thing is that this opting out of the once you sign in the voluntary form, the like donor card or donor I'm ready to give my organs and all. Once the death occurs, as you said, the family, one of the family member will step in and he'll block the whole program. So what I suggest is this awareness has to go into all the family members and through the media, visual, audio medias, and all. It become a normal thing. That is the only way to increase the donation. That's what I suggest. From the government side, I think they're doing a relatively good job, and they're very suggestible also. Like what the one-to-one contact, as I mentioned, what I had with the staff members of the retrieval team and all, they are very good. They are very, and 2-3 meetings together we had with you also with there with the DHO. They're very interested in taking this into the next level.
Okay, thank you, Dr. Mujib. Dr. Joseph, your suggestion to the government and advice to public, briefly, please. Please unmute yourself. Yeah.
To the government, it is basically that when we think of transplantation, the most important thing is the donation. The donation is not happening. I think there should be more cooperation between the stakeholders. The stakeholders include the government, the hospitals, as well as the public at large. And we should have more interaction between these people, and especially the media. The problem is always the media. The media always creates unnecessary hypes, unnecessary controversies in the donations. And I think most of the government, most of the government's systems are reasonably well oiled, and the brain death program, brain death certification is very mandatory, legalized, and it is going in a very smooth manner. But the problem is created always by some of the medias, and they are creating unnecessary hypes.
Okay, so thank you, Dr. Joseph. Although as a media, we always try to give the positive views. We never try to create any negative things so that the people will be deviated and debarred to do any organ donation. We always believe that positive media is required, and that is why this media is there. Thank you, Dr. Joseph, for giving your views. Dr. Pai, your suggestion to the government and advice to public.
Yeah, the suggestions to government are very crisp. Incentivize the donation. Whoever is donating, incentivize either through jobs or through cash or through any other ways, whatever you find so. Increase funds and staff for organ donation. Increase awareness among general public. And for public, I would like to say, do not take your organs with you after you die. It is required on earth for so many of them who are actually dying on earth without the organs. Once you donate, be sure you are definitely going to reach heaven after death. And in this COVID time, stay safe, put your masks, don't be at home only if possible, only if it is very urgent, go outside. You are not only saving yourself, you are saving even the healthcare workers and doctors. Thank you.
Thank you, Dr. Pai, for giving your suggestions. So today you have seen that the expert opinions of the doctors who are involved in organ transplants, and their views are very, very clear. Yes, they have to be very cautious, but it is not that there are any reports of contradicting that the organ transplants or organ donations are going to be an effect of COVID-19 so that you cannot donate or the transplant should not take place. They will take full precautions, but after all, the matter of saving lives. And to save lives, the doctors and the hospitals and the health workers are doing their best. And we all must cooperate with them. And we should see to it, even from the organ donation point of view, we should not stop this program because the coronavirus has to stay. If it is staying, we should also continue and save more lives which are dying because of the want of organs. And today's program, which was live telecast by V4 News, Global TV, V4 Streams, Malnadu TV, News Gaon Se, Samvad Sarokar News, as well as it was shown live on Facebook and YouTube. And our endeavor is to bring every day a new topic. And tomorrow our topic is, or for media conference with Lal Goel, is COVID-19 impact on gardening. Yes, you have heard correctly. It's impact on gardening. And for the expert panelists are Miss Rama Tyagi, President Horticulture Floriculture Society, Ghaziabad. We have Dr. Kanak Durga Vimlapati, Consultant Healthcare and Hospital Management, Hyderabad. We have Miss Lovely Kathuria, Founder President, the Horticulture Club, Agra. We have Miss Sujan Fernandez Sen Gupta, Founder, Swiss Organic Agro Products and Services Incorporation, Pune. So please tune in tomorrow for media conference with Lal Goel at 10:30 a.m. Thank you very much, Dr. Mujib. Thank you very much, Dr. Joseph. And thank you very much, Dr. Pai, for joining and giving us your expert opinions about organ donation, impact on organ donation. Thank you, all the viewers.